Alrighty guys, today we're going to be going over the BiPAP skincare guidelines, and these are going to be guidelines for any patient that will be requiring BiPAP in the hospital. Now, to start with, any patient that's going to go on BiPAP, we're going to place a wound care consult and notify the bedside nurse. Then we're going to apply Mepitel to the nose and Mepilex border to the back of the neck of our BiPAP patient. So along with that, we're going to be starting full skin assessments every 4 hours, which includes offloading the mask, inspecting the skin, and replacing the skin barriers every 4 hours. So this means the entire apparatus must completely come off the skin in order to go ahead and inspect the skin under the mask and straps. After that, we ask ourselves, can the patient tolerate changing mask types? If the patient can tolerate different mask types, we're going to alternate each mask every 4 hours along with our full skin assessment. If there is, after your pressure assessment and skin assessment, no pressure injury noted, we're going to continue just alternating masks every 4 hours and inspecting the skin. Now, if at the 4-hour check there is redness or pressure injury noted, we're going to begin Q2-hour skin assessments and changing the skin barriers still every 4 hours. Now, if the patient cannot tolerate alternating mask types and they have to stick to just one mask, then we will also be doing Q2-hour skin assessments with Q4-hour skin barrier changes on those patients. Now, if after doing Q2-hour checks, there is no pressure injury noted, we would just continue doing Q2-hour skin assessments and checks. If after already doing Q2-hour skin assessments, there is pressure injury noted, you would contact your wound care nurse, RT manager, and notify your physician for further instructions. Now, there are patients that have high risk for skin breakdown, and those kids are going to be people already requiring Q2-hour full skin assessments, as below. Kids already with a history of skin breakdown, kids with a history of poor healing, children with prominent nasal bridges, or with facial structures that inhibit a proper mask fit. And as a reminder, for all patients on BiPAP, we do not use swing cream. We do not apply any product other than Mepitel or Mepilex border without a physician or wound care consult already in place. And we must collaborate as a team at least once a shift, Q4 or Q2-hour assessment, with the nurse, respiratory therapist, and provider. So the provider must check up on your BiPAP patient's skin at least once a shift.